I'm Dr. Hannan, a GP, family physician, MD at Horton Thornley Medical Centres in Hyde, Manchester, UK, and I'm also the chairman of the World Health Innovation Summit. Welcome to WIS, Greece. I'm very sorry I can't be there, unfortunately, today. Due to clinical commitments, I've not been able to come. But I'd like to share a few thoughts about who the WIS is, why it matters, and what we can do to work with yourselves. The World Health Innovation Summit was set up because we want the best healthcare system in the world. We all want it to be the most efficient and the most effective way so that everyone benefits. The World Health Innovation Summit is a new innovative way of bringing people together and ideas together and starting to see how we can share those ideas that already exist in the community where we live, and so that everyone benefits as well. It's about bringing patients, carers, clinicians, managers, business people, educationalists, politicians, and anybody that is interested in health and well-being to come together to try and support each other so that we can all benefit and get the best with whatever we have. So, how do we do this? Well, together we inspire, together we learn about innovations, about things that we are doing so that we can spread them and ensure that other people from all around the world can benefit as well. And that idea of globality, because actually when it comes down to it, whether you are a little girl here in Manchester, whether you're a father there in Greece itself, or a mother over in Africa, or a daughter in the Far East, we've all got similar needs, similar wants. We all want to feel safe. We want to feel secure. We want to feel that we're getting the best we can to improve our health, not just for ourselves, but our families too. They're all very, very similar needs. And what we're finding is that there's wonderful ideas and solutions that already exist in the community that we in healthcare can benefit from. I'm really pleased to hear about the Americai people. And when Christiana came over to our first summit in Cumbria and shared the wonderful stories about what you are doing up on this mountain and how you've built a whole economy around looking after the land, helping each other, supporting each other, and the consequences of that which lead to mindfulness and people feeling happy about who they are and what they are, and the kinds of things that you're doing so that you're looking forward to old age. It was a breath of fresh air for all of us to hear, and we were really excited to hear that we wanted to come over and hear what you have to do and learn about what you're doing and spread that message. Because today, wherever we are in the world, more and more people are living longer with more and more conditions and finding it becoming more and more harder to be able to do the things they want to do because of the challenges that they're facing. Medicine has made huge strides, there's no doubt about that, but we're now starting to find that there isn't a tablet for every ill. There's things like depression, loneliness, things like interactions between different medications, people complaining of back pain, hip pain, problems within families and communities. And then there are other social problems such as drugs and alcohol use, which are really blighting our communities and making it more and more difficult for people to live and survive. And yet, what we hear about amongst Americai people is that there's a new kind of community coming together where people are learning from each other how to support each other, how to help each other, how to work together. And at the same time, you have a healthcare system. You have your own doctors, your own nurses, and other people, pharmacists and so on. And the great opportunity here is for the healthcare system to work with yourselves, the Americai people, in the community so that we can support each other. That would then take a little bit of pressure away from the healthcare system to allow those people that can look after themselves to be able to do so. For too long we've expected the medical profession to do everything for us, and I feel now is the time for us to work in partnership together with the community to support each other so that we all benefit. There are certain patients, for instance those with diabetes that needs insulin, or perhaps someone with severe back pain who needs major surgery, who clearly you're not going to be able to fix. And those are the kinds of patients who definitely need to come and see the doctor and be referred on to the hospital if need be. But there'll be other patients who perhaps have developed depression because they're lonely, or perhaps they've got back pain because they've become unfit and they're not as active as they used to be. And if they can be encouraged to engage with other people in the community and maybe find people just like themselves who've managed to overcome their back pain, their depression, their loneliness by supporting each other and helping each other, then maybe, just maybe, they might become less depressed, less lonely, and start to feel more positive about themselves and the community around them. So I'm extremely excited to hear about the work that you're doing and the work that Christiana and Anna Bloom, who've helped to put this conference together in Greece, so that we can all learn from you, find out what you're doing, and also give you an opportunity to share the wonderful things that you're doing with all those people attending. So once again, I'm extremely sorry I can't be there today, but I hope you have a wonderful conference and I look forward to hearing from you soon. Thank you very much.